Welcome to the second part of your annual ACE suicide prevention training, specifically the Lethal Means Safety Module. This training is designed in such a way to promote communication, cohesion, and trust within your unit, which are all factors that protect against the risk of suicide. Simply put, paying attention, engaging in the discussions and activities, and keeping an open mind about lethal means safety can help save a life and save many more from the heartache of losing someone to suicide. Many may ask, why have a firearms and suicide prevention program? Primarily because suicide is a major public health issue and remains the 10th leading cause of death in the U.S. It is important to note that half of all suicides in the U.S. are by firearm. Nearly 2/3 of all firearms-related deaths in the U.S. are suicides. 85 to 90% of suicide attempts with a firearm are fatal. Untreated mental health issues can negatively impact relationships, work performance, social interactions, well-being, and physical health, leading to difficulties in daily functioning and quality of life. It can also strain family dynamics and cause social isolation, as well as conditions like depression, anxiety, and substance use. That risk increases when a firearm is present and easily accessible in the home. It is vital to highlight that no one takes their life for a single reason. It is often due to a multitude of things that have not been properly addressed. Temporarily removing lethal means from someone in suicidal crisis greatly reduces the likelihood of that person dying by suicide, because it gives at-risk individuals something they crucially need: time. Research shows removing access to firearms and other lethal means allows time for both the moment of intense suicidal crisis to pass and for someone to intervene with potentially life-saving mental health support and resources. Let's take a look at Drew Robinson's story as a learning tool. His story highlights the importance of suicide prevention and intervention. Drew Robinson was once known for being a Major League Baseball (MLB) player of the Texas Rangers and the St. Louis Cardinals. While having achieved his goal of making it to the big leagues, his experience was anything but easy. He had been demoted to the minor leagues several times, and he had injured his left elbow and required surgery. In August of 2019, the Cardinals released him. Despite his continuation with behavioral health therapy, he felt increasingly frustrated with himself, and he was worried he was going to end up in the minor leagues again. Little did anyone know that Drew suffered from depression and suicidal ideation. Drew felt as though he was not good enough for his fiancée, and he called off the wedding. After becoming increasingly isolated by the COVID-19 pandemic, he asked himself, who would care if I'm gone? That evening, on April 16, 2020, Drew sat on his living room couch, drinking whiskey, and shot himself in the right temple. Drew Robinson survived. Key points in Drew's story are: Drew seemed to have a good life. He had been a professional athlete for 10 years and was engaged to be married. Yet in 2020, Drew attempted suicide with a handgun. He survived, but he lost his sense of smell and taste, as well as his right eye. The saying, hindsight is 20/20, applies here as we get to look back at what was going on in his life and see it more objectively. The risk factors and warning signs in Drew's story include: Drew was once known for being a Major League Baseball player of the Texas Rangers and St. Louis Cardinals, before being demoted to the minor leagues on several occasions. He had injured his left elbow and required surgery, which most likely affected his ability to play in the major league. He felt increasingly frustrated with himself and worried that he would end up in the minor leagues again. Drew suffered from depression and suicidal ideation, and most likely was using alcohol as a coping mechanism. He called off his wedding, which could indicate relationship issues. Isolation during COVID-19 most likely heightened his depression. A combination of issues, including not feeling like he was good enough for the major leagues again, not feeling like he was where he wanted to be in life, the cancellation of his wedding with his fiancée, isolation during the COVID-19 pandemic, and his previous mental health struggles most likely contributed to his suicide attempt on April 16, 2020. If Drew was one of your friends or a member of your unit, what would you do? Examples may include talk to his squad leader, talk to Drew, take him to the chaplain, use ACE. This is just a snapshot of Drew's story used to engage soldiers to lean into this topic. It's important to note lethal means safety is more about the focus of this training than analyzing or discussing the details of one specific case. Even with the best intentions, some risk factors and warning signs can go unnoticed. They may not become obvious until after the fact, hindsight. What's more, suicide is not always preceded by observable or actionable warning signs. Therefore, another effective and critical approach to suicide prevention is taking physical measures to secure lethal means. Some ways you can help someone with depression: listen. Let them know you care and are there to listen without judgment. Encourage treatment. Help them see a healthcare provider or mental health professional. You can also help them stick to their treatment plan, such as by setting reminders for medications. Offer support, provide understanding, patience, and encouragement. Remind them that their depression can improve with time and treatment. Simply put, access to lethal means is a risk factor for suicide. Reducing access to lethal means saves lives. Firearms are the most lethal among suicide methods. This brings us to the purpose of this lethal means safety module. The purpose of this module is twofold. First, this training aims to enhance soldiers' understanding of lethal means safety as a protective factors when risk factors are present and when warning signs have been observed. Second, this training provides the opportunity for soldiers to consider and discuss ways to promote lethal means safety for themselves and others to help prevent suicide in their unit and in their circles of support. Third, this training provides an opportunity for soldiers to consider and discuss ways to promote lethal means safety for themselves and others in order to prevent suicide in their unit and in their circles of support. American Foundation for Suicide Prevention, AFSP, endorses suicide prevention education as a basic tenet of firearm safety and responsible gun ownership. From practicing safe storage and the temporary removal of access to firearms when someone is at risk, to learning about common risk factors and warning signs for suicide, there are simple actions we can all take to help save lives. An overview of the lethal means module entails to define lethality and review factors that influence the choice of lethal means by a person who is suicidal. Identify effective safety measures that can create a physical barrier to lethal means accessibility and lethality. Focus on discussions regarding practical applications of ACE, as well as other strategies and considerations pertaining to lethal means safety. Let's get started. To ensure we are all on the same page, let's define the terms we are discussing today. Lethality refers to the capacity to cause death, serious harm, or damage. The level of lethality matters as it can impact whether the attempt results in death. Lethal means refers to the methods that can be used in a suicide attempt. Just as there are various methods or means that one might choose to use to attempt suicide, the methods vary in levels of lethality. Lethal means safety in suicide involves making a method less available and less likely to cause death in a suicide attempt. The goal is to make suicide methods, or means, more difficult to access when someone is at risk for suicide. To better understand lethal means, we will review the factors that influence one's choice of suicide method and influence the lethality of methods. One factor that influences a person's choice of suicide method is the acceptability to the attempter. This can be influenced by acceptable levels of pain or suffering involved. It can also be influenced by perceived cultural acceptance. For example, because firearms are a big part of military culture, it may make their use seem more acceptable for military personnel. Additional factors that influence a person's choice of method are accessibility and ease of use. The easier it is to gain access to the method of killing themselves, the more likely it will be used for that purpose. For some, if a method requires technical knowledge a person doesn't possess, then it is less likely to be used. As previously noted, some means of suicide have higher lethality or capacity to cause death than others. I would like for each of you to think about why might the lethality rate be higher for firearms, jumping, or hanging versus drug poisoning or cutting. A key factor that can influence higher lethality rates for some suicide means is inherent deadliness of the method. Some methods, like firearms and jumping, inherently lead to more fatal outcomes than others. In fact, firearms have the highest case fatality ratio. The percentage of suicide attempts resulting in death are 85 to 95%, when using firearms as the lethal means. On the other hand, suicide means that allow the ability to abort mid-attempt or offer a window of opportunity for rescue also influence lethality. Some individuals who have survived a suicide attempt have reported that, in the midst of the act, that they changed their minds. They reported that the ability to abort mid-attempt is what saved their lives. It is worth noting that Drew Robinson was one of the lucky few who chose a highly lethal means and survived due to a window of opportunity for rescue. Risk factors are characteristics or conditions that increase the chance that a person may try to take their life may entail serious physical health conditions, including pain, mental health conditions such as depression, anxiety, or PTSD substance use problems, environmental issues such as stressful life events like rejection, divorce, financial crisis, other life transitions or loss, exposure to another person's suicide, or to graphic or sensationalized accounts of suicide, prolonged stress such as harassment, bullying, relationship problems, or unemployment, or historical events such as previous suicide attempts, family history of suicide, childhood abuse, neglect, or trauma. Hopefully by now you all are recognizing the need to put safety measures in place. So let's talk about how to practice lethal means safety. The goal of lethal means safety, LMS, is to put time and distance between a lethal means and a person at risk for suicide, thus making immediate access to the means more difficult and ultimately lowering the risk of death by suicide. Most suicidal crises are short-lived. The time between making the decision to attempt suicide and physically making the attempt is typically less than an hour. Sometimes a person moves from thought to action in less than 20 minutes. It is in these moments that LMS/safe storage behaviors can save lives. In the Army, lethal means, such as firearms, are sometimes a part of our job. Safety and leadership in firearm ownership are necessary when working with and owning guns. At times, lethal means safety efforts have been misinterpreted as attempting to restrict Second Amendment rights and autonomy. This couldn't be further from the truth. Army lethal means safety efforts aim to prevent suicide by supporting decisions for safe storage behaviors. 90% of individuals who survive an attempt do not go on to die by suicide later. If we can reduce the lethality in a first attempt, you can potentially help reduce future attempts or completions. Even if it was not practiced prior to an attempt, lethal means safety is valuable to practice after an attempt to prevent future access during crisis. Drew nearly attempted again and had ready access to do so. By safely storing lethal means objects, it is less likely that someone in crisis will make a lethal suicide attempt. Safe storage aims to prevent yourself or someone else from quick access to lethal means in the event of an at-risk or into. For example, to securely store firearms, you could use a cable or trigger lock, install a breech lock, and/or remove the firing pin. Additionally, storing the ammunition in a separate locked container and/or in a separate room. Prescription and non-prescription drugs, along with household toxins or poisons, can be locked in a medicine cabinet to prevent both accidental and intentional overconsumption. Additionally, storing daily doses of medicine in individual bags or containers. You might also want to consider securing tear-resistant materials that may be used for ligatures or nooses, such as bed sheets, ropes, and electrical cords. By engaging in these safe storage practices, you are lowering the risk of both suicide and accidental death. Having a conversation on lethal means safety as a protective factor can help an individual trust that others will know what to do when risk factors and warning signs are present. Now let's look at how to put this into practice. Think about what lethal means safety looks like as a protective factor and the importance of discussing protective factors in relation to lethal means safety. Examples. Talking to a peer about lethal means can demonstrate that you care, which can build trust in the relationship. Asking about lethal means may lead to new information that could help identify risk factors. When faced with risk variables related to lethal means safety and how to minimize them, consider storing firearms and ammunition separately takes longer to load the firearm. Having to unlock a safe, pick up the gun, and then go get the ammunition takes even longer. Dosing out medications for 1 week's worth and locking up the rest makes a person take more time and trouble versus ease of accessing an unsafe amount. People have a chance to change their mind. When considering the severity of lethal means measures, it is critical to consider warning indicators and the relevance of decreasing them. Ask if the person has the means on their person or in the room. If the answer is yes, then separate the person from the means. Ask them to hand the lethal means, such as the weapon or drugs, over to you or someone else they trust. Lethal means safety creates a physical barrier, preventing the individual from quickly accessing the lethal means. The time and space provided by lethal means safety can give an individual more time to get out of crisis and for another individual to intervene. When considering the severity of lethal means measures, it is critical to consider warning indicators and the relevance of decreasing them. Ask if the person has the means on their person or in the room. If the answer is yes, then separate the person from the means. Ask them to hand the lethal means, such as the weapon or drugs, over to you or someone else they trust. Lethal means safety creates a physical barrier, preventing the individual from quickly accessing the lethal means. The time and space provided by lethal means safety can give an individual more time to get out of crisis and for another individual to intervene. Many of our discussions thus far have been focused on how to go about lethal means safety for ourselves and for others when physically present. Yet the reality is that not all of your friends and family live locally. Most of you are in contact with them in some way, whether that be social media, phone, texting apps, or email. Even if you are not physically present, you can still address lethal means safety proactively and help to secure lethal means in the case of concern or crisis. To mitigate risk from a distance, you can leverage technology to monitor situations, implement strong communication channels, establish clear guidelines such as a suicide prevention action plan policy for your command, and provide necessary training to individuals, all while maintaining a focus on proactive risk identification and response planning. Some ways you can help others with lethal means safety when you're not physically. Have a proactive conversation about the need for lethal means safety. Talk to them about establishing physical barriers, i.e., locks and safety. Express your concern for others, i.e., children. Talk to a mutual friend or family member that has the ability to be physically present. Call 911 if the person has said they are going to kill themselves and they have the means. Educate family members and others about ways to limit access to lethal means during a crisis. Collaborate with others in your community to increase safety. Local VA Hospital Suicide Prevention Coordinator, USAR Psychological Health Program, PHP team, or your local police department. Distribute free gun locks or gun safes. Free gun locks are available through your local VA hospital. If you or someone you know is in crisis, reach out and dial 988, the Suicide Prevention and Crisis Lifeline. Veterans and service members, press 1. You can also chat online at veteranscrisisline.net or send a text message to 838-255. Confidential support from caring VA responders is available 24 hours a day, 7 days a week, 365 days a year. Now that we've covered lethal means safety, let's talk about your next steps. Lethal means safety is an evidence-based suicide prevention practice that involves making a suicide attempt method less available or more difficult to access immediately, therefore less likely to cause a fatal suicide attempt. Keep in mind that putting time and space between someone experiencing suicidal thoughts and their access to lethal means reduces the risk of harm and can save lives. In the United States, the most common and most lethal method of attempting suicide is by firearms. Preventing suicide requires taking proactive steps. In addition to the plans we have discussed in today's training, here are some proactive steps you might consider taking with your fellow soldiers and others within your circle of support. Engage in meaningful conversations with unit members, friends, and family members to enhance communication and connection and to build trust. Ask who they feel most comfortable talking with if there is ever a concern or moment of crisis, and share that same information with them about you. When they are facing a challenge, encourage them to use resources proactively, such as when there is even a hint of concern, rather than wait until it's a crisis situation. Throughout a typical day or week, you have many opportunities to apply what you've learned today in the ACE-based module and this +1 module. Based on everything we've discussed today, I'd like you to consider at least one thing you can do in the next week or two to help reduce the risk of suicide inside your unit or command, as well as among your friends and family members. Examples may include: draw on one of the Army values when tempted to avoid uncomfortable conversations or needing to address lethal means safety matters. Talk to a friend back home that may be struggling a bit about the need to lock up their guns or medications. It is important to remember that in order to prevent suicide throughout the command, we need to promote awareness and take action to ensure the safety of lethal means. By placing a barrier between an individual in suicidal crisis and lethal means, the individual has time and space to seek help, such as by calling the 988 Crisis and Suicide Helpline. Resources are crucial during a crisis because they enable effective response efforts by providing the necessary tools, supplies, personnel, and funding to address immediate needs, mitigate risk, and support recovery, ultimately allowing for a faster and more efficient response to a crisis situation. Proper resource allocation is key to prioritizing critical needs and maximizing their impact. The resources presented include local resources, crisis hotlines, OCONUS emergency services, as well as lethal means safety resources. If these resources are not close by or accessible, the nearest emergency room can also be a good option. Ultimately, your best choice may simply be reaching out by phone to a crisis hotline or emergency services. The QR code at the bottom of the screen will take you to the DPRR, Directorate of Prevention, Resilience, and Readiness. Lethal means communication materials. In it, you'll find tip sheets and checklists for both commanders and families. The link listed in the Lethal Means resources is the Lethal Means Toolkit, PDF, which includes valuable information about safe storage, communication strategies, and more. Resources include but are not limited to your chain of command, emergency room, police department, and 988, the Suicide Prevention and Crisis Lifeline. If you're struggling, it's okay to share your feelings and reach out for help. The truth is that you may know someone who is not storing their lethal means safely and might not show any signs for concern. That someone might be you. Consider those around you who may have access to those lethal means and ask yourself, what if? I encourage you to make lethal means safety a topic of conversation with your peers, as well as with your friends and family. While these conversations have potential to be awkward or uncomfortable, and in some cases not wanted, hopefully you recognize that talking about lethal means safety is needed. Remember, you can use ACER as a way to build trust, so if someone is in crisis, then there is an open line of communication already established to where you can provide support. Furthermore, having a conversation about lethal means safety proactively will also equip you with knowledge as to their access to lethal means. Each individual has the responsibility and the power to make a positive difference when it comes to suicide prevention. Be the difference with your battle buddy, team, squad, company, and families. If you know someone who has not secured their lethal means, demonstrate care by having that conversation with your friends and loved ones. Lethal means safety plays an important role in suicide prevention and intervention. It is important for you to know and understand you are a part of the Army's comprehensive and integrated approach to preventing suicide and protecting others from its devastating impacts. The Army and its people need you to concentrate your efforts in the prevention strategies within your control and influence, which you have gained from today's training. Connect to Protect, Support is Within Reach theme from the Defense Suicide Prevention Office highlights how social connections and a sense of belonging serve as protective factors against suicide. Consider what that might look like for you, such as what actions you feel are important to take in the next week or two. ACE can save a life. Remember to ask, care, and escort. As members of the Deployment Support Command DSC family, we will continue to support with pride and uphold our Army values of loyalty, duty, respect, selfless service, honor, integrity, and personal courage as we care for one another during good and trying times. Keep in mind, we as a team and members of the DSD family all play an important role in combating suicide across the command. Let us continue to maintain the motto, suicide prevention is everybody's business, as we remain committed to the goal of preventing suicide across the command. Lastly, thank you for attending today's training. Your participation is evidence of your support and care for your soldier and others in your circle of support.